What's going on, everyone? Welcome back to another episode of the Muscle Memoirs podcast. Today, it is my pleasure to be joined by Dr. Eliza Gordon. Dr. Gordon, how you doing today?
Good. How are you, Mike?
I'm doing wonderful. Thank you so much for coming on the Muscle Memoirs podcast. I am super excited to get into our topic of discussion for today. For our listeners who might not be familiar with you, could you provide us a brief introduction about yourself?
Yeah. So I got my Ph.D. in clinical and health psychology from the University of Florida, as well as my master's in public health. I did a clinical internship at Geisinger Medical Center in Pennsylvania, and I'm currently a postdoctoral fellow at the University of Utah, working in bariatrics and weight management. I also have a background as a certified personal trainer. My undergrad was in exercise and wellness with a minor in psychology. So the whole mind body health aspect has always been really interesting to me, as well as a background in when I was getting my bachelor's, doing both research and some clinical work with addiction recovery.
Very cool. I think you definitely check all of the boxes that we're looking for on the podcast when it comes to the guests. Now, for our topic of discussion today, we're going to be diving into the concept of food addiction, which I think is something that's absolutely fascinating. Um, to be frank, this is a relatively new concept, right? I think when it first came on the scene, as far as most evidence-based practitioners in the sphere go, I think when it first came to the surface, many kind of brushed this concept aside. They weren't taking it too seriously, and in regards to that, the research was quite novel. There wasn't a lot there, but this is a rapidly developing field. And you recently were part of a review paper that I found made an extremely compelling case. And I ultimately wanted to have you on today to expand upon those findings, to spread this message to the public, gives them something to think about. So, with that being said, I think we can set the stage for our conversation today by outlining some basic definitions to get things rolling. Could you explain to our listeners just what exactly is addiction in general?
Yeah. So there's a lot of different definitions of addiction depending on which viewpoint you're coming from. As a psychologist, I've probably the most comprehensive, like clinical or medical oriented definition you can find from the American Psychiatric Association or the American Society of Addiction Medicine, and they have paragraphs talking about how addiction is a neurobiological behavioral condition that people experience, basically, where you can kind of boil it down to what one of my mentors has called the 4 C's, Dr. Merlot. It's compulsive use, lack of control, continued use despite consequences, and craving. So those are kind of some of the main components of addiction. All of these definitions also emphasize that it is very treatable as well, which I think is important. But another kind of simpler definition that I really like as well, theoretically, is just from the Oxford English Dictionary. So it is physically and mentally dependent on a particular substance. And I think that it doesn't cover all the medical aspects of it, but it kind of boils it down, I feel like, to a very succinct sentence. And interestingly, in that same dictionary, I found that it talks about the origin of the word, and it says it comes from a mid-16th century adjective, addict, which means bound or devoted to something or someone, which, if you've ever worked with or been yourself addicted to anything, that's kind of, I feel like, a very poetic way of describing it. It does feel like being bound to that substance or thing. So
I appreciate you boiling down that concept for us. As I was looking through this paper, it was extremely nuanced, and This is obviously outside of my scope, right? I'm a registered dietitian and I'm looking at this, and you basically have a whole page dedicated to these several definitions of addiction from different bodies on the topic. So to put that plain and simple for our listeners, I think is a great way to set the stage here. And this brings us into the crux of our discussion today, which is ultimately why I think many people were brushing aside this concept when it first emerged, and that is, how can we be addicted to food if it's necessary for survival, right? So in this concept of addiction, it's usually we're talking about drugs or other things that we don't necessarily need, right? But when it comes to food, most people might put forth, well, aren't we all addicted to food, considering that, it's a big part of our lives? We're consuming multiple meals per day. We need to consume multiple meals per day in order to live well and to live long. Can you break this down for us? What is the research at this current point in time that would really convince us that there are some reasons to believe that you can be addicted to food? There is another level to this besides just saying, well, yes, we all need to eat, but there are different different categorizations of what that means.
Yeah, definitely. And those are good points. And I've definitely heard that argument many times. But it's been a while since I've heard it, probably maybe because of the circles I'm in, or because of the increased research that we have now. Um, but yeah, and I've heard people say, like, that's like saying we're addicted to air. I have to breathe. Which, if you take food addiction literally, then yes, it is not feasible to think about being addicted to food in general. However, the research is pretty clear that the addictive like responses in the brain and behavioral symptoms that we're seeing are not all foods are equal in producing those, and some foods kind of produce the opposite of those two, like vegetables, for example. But the foods that are producing the addictive like responses in our studies are the more what we call highly palatable foods, which are typically like highly processed foods that are high in sugars and fats. So you think of your like Doritos that you can't stop eating, or ice cream, or pizza, things like that are man-made and specifically designed with ingredients to be difficult to stop eating. And there's a purpose for that on the business side of things, but it's usually those types of foods that we're seeing these responses to.
Excellent. Now, can we dive into some of the biological or behavioral similarities between overeating and drug use? You mentioned there that there are some things going on in the brain that would lead us to believe that food addiction is probably something that we should be taking more seriously. Can you touch on those similarities?
Yeah. So most of the food addiction research started in animals like rats. And we were some behavioral similarities in like rats having compulsive consumption of like sugar solutions, for example, where they just kept pressing buttons over and over again to eat the sugar. So kind of that's one similarity, is the difficulty controlling consumption. We call that impaired control. Other behavioral similarities can be a preoccupation. So someone who's addicted to drugs is kind of like it's always on their mind. It's their number one goal, really, most of the day. And a lot of people who report feeling addicted to food not only report impaired control, so difficulty controlling their consumption, but also they're like constantly thinking about it, whether they're eating or not. Some other similarities: there's some evidence for symptoms of tolerance or withdrawal. It looks a little different in people reporting feeling addicted to food than it does in people reporting drugs, but some of the similarities are like increased anxiety, restlessness, again, can't stop thinking about it when they're not having it, irritability, things like that for the withdrawal aspect. And then for the tolerance aspect, we have seen, and addicted or not, most people have noticed themselves too, that often, the more consistently you eat a certain food, especially the highly palatable foods, the more you can consume, or the more you have to consume to get to the same like level of satisfaction sometimes. So that's what we call tolerance, and that's a similarity with drug addiction. In the brain, we also see some similarities. And again, all of this is, like you said, very new, so we're still learning. And some people will still argue that the research we have is not adequate, but it does show some pretty consistent similarities. So in the brain, we have imaging studies where we can see like which parts of the brain are responding in certain ways to certain, either food consumption or looking at pictures of certain foods. And we've tried to mirror some of the drug addiction studies with those certain foods and are finding similar areas of the brain being activated. So for example, the reward system, like the nucleus accumbens is a very well-known reward system area in the brain, and that can be activated both by drug addiction and also by certain foods in patterns that are similar to drug addiction studies. So we also just came out with a paper where we kind of go through a little bit more the specific brain areas that we've seen in recent human studies and how they relate to research on drug addiction. And I think that article is just available online. So if you're interested in more details, then you can look there too.
And I will link that paper in the show notes. But that was an excellent overview of the details of this topic. I think an important distinction here is what we mean by hyperpalatable foods, because I think a large part of why people might not have been taking this concept seriously to begin with is due to a related area, and that is the foods that are driving addiction. And I saw a lot of people, I still see it to this day, a lot of people put out that sugar by itself is addicting. And you mentioned that we have these rodent studies, and there seems to be these addictive qualities to sugar water. But when we look at the human research and when we look at hyperpalatable foods, or the foods that tend to make us want to overeat the most, it's usually a combination of ingredients, like you said, man-made, ultra-processed foods. It's not that people are getting their spoon out and going into the bag of sugar at home that they put into their coffee every morning, or they just can't stop eating Wonder White bread or something. Can you tell us more about the foods in the research that we've looked at that tend to drive overeating? And then also, on top of these specific ultra processed foods, do we have anything looking at whole foods or minimally processed foods, and if those are addicting?
Yeah, those are both really good questions. Yeah, so like you said, the sugar itself thing plays out with animals, but not necessarily with humans, and so we don't really know exactly why yet. There's not a specific, like with drug addictions, there's a specific substance, right? That's like the center of the addiction: alcohol use disorder, marijuana use disorder. But and also, I guess a little side note, addiction, the American Psychiatric Association says that addiction is not really a diagnosis itself, but it's more of a description of maybe like a severe substance use disorder. So just a little side note. So the types of foods, like we said, are the ones that tend to be high in fat and sugar. The ones that are high in sugar and low in fat usually aren't really playing out with these symptoms, although sometimes soda or sometimes diet soda have shown these symptoms too, depending on what study you look at. So there's definitely exceptions. It's definitely very kind of ambiguous at this point, but the processing is definitely a common factor that we're seeing across the board, as well as the high sugar and usually high fat. And when I say high sugar, I guess I also mean high, like refined carbohydrates, like French fries, for example, and pizza are definitely also in that category. When it comes to whole foods, we haven't really seen any evidence, definitely no convincing evidence of really any whole foods that I'm aware of in the literature of being potentially producing these addictive-like responses. There have been some in like the 90s. There were a few papers published reporting like examples of potential carrot addiction, which is interesting, but I don't I don't know that anyone's tried to replicate those. I haven't seen any studies come out since the 90s about that. So that would be interesting to see. I've also heard some anecdotal reports of like someone was telling me that, I think I've heard this from a couple of people actually, that a couple of patients that we had, or that they had, I didn't actually meet the patients, but were saying that they were addicted to milk and that they just couldn't stop drinking milk. I think it was like 1% milk or something. It was some like, I don't know, normal type of milk. And so I thought that was interesting, but I haven't seen that pan out in research. And so things like that. I think there was one other thing that I thought was interesting about a whole food. Where did I write it down so that when I forget it?
Did I
But
see something about nuts, or am I making that up?
yes, so that was, yeah, we mentioned that in our systematic review that you read. There was one of the food addiction studies that was a more recent study. It was more of a self-report, like people were filling out questionnaires of like, you know, which foods do you have problems with when it comes to addictive like symptoms. And nuts were not like at the top of the list, but they were rated higher than granola bars, which you kind of think like granola bars have added sugar and, you know, refined carbohydrates usually in their process, so you think they'd be higher on the list. But in that one study, at least, the nuts were rated higher. And I do frequently, in the weight management world, I frequently hear people talking about like they can't stop eating nuts too. But again, also you look at nuts and you can say, well, most nuts that people buy from the store, they're definitely high fat, and they also have these usually very processed oils that they're in, like peanut oil or, you know, sunflower oil, that are usually very processed. And so I've kind of wondered, but I haven't seen that. I haven't seen like processed oils, for example, in the literature yet, unless I've just missed it. So yeah, it's just interesting. We've got a lot to learn. And that's one of the flaws in the food addiction concept, is that it is so ambiguous of like, you know, there's not one thing necessarily. It's hard to predict exactly what foods, although we do have a better idea of like, in general, what types of foods are most likely to cause oh, I remember what the other food was. I saw at a research conference, I saw a poster of someone who did another food addiction survey among, I think it was Hispanic adults. And in that one, that was the first time that I'd seen people rate like meat at the top of the list. Like I think it was red meat. It's been a few years, and I've kept looking for that poster to see if they published it, but they haven't. So, or at least not that I've seen. I haven't seen it. So, anyways, I'd be interested if someone looks at meat too. But
Yeah, that's really interesting. I would have never guessed that. When we look at these food questionnaires about addictive foods, it seems like there's been a handful of trials on chocolate as well. That seems to be something popular that people identify as being pretty addictive. I haven't looked into it thoroughly, but I would assume that's probably milk chocolate as opposed to like 90% dark chocolate, right?
I would probably guess so. I don't think most people like 90%.
For sure. When we consider this concept of food addiction, do we have any data looking at what is driving this addiction? So, is this something that seems to be more so a byproduct of the modern food environment? I think regardless of how we tease this out, a large part of it's going to be due to the modern food environment, right? Like, this is a relatively new concept, and it's probably because our our ancestors, I mean, even 100 years ago, this wasn't something that people had to deal with. Like, we just didn't have this expansive access to very cheap, hyperpalatable, energy dense foods. But if we consider the impact of the modern food environment and then also genetics, do we see perhaps in any of these neuroimaging studies that some people just like aren't triggered by these hyperpalatable foods, and perhaps something genetically is going on which makes people more susceptible to food addiction than others?
Yeah, I think those are really good points, and like you said, we don't know a lot about the causes right now, but it's definitely a minority. Like even in the United States, where we think of the worst kind of highly palatable food environment, um, it's a minority of people who meet criteria for food addiction. And even if you're just looking at people with obesity, it's still a minority. It's like 19% was the last estimate I saw for people with obesity who meet criteria. But again, food addiction is not it's not an official diagnosis. I should have said that up front. Definitely not. It's more a matter of research right now. But I think among US adults in general, not just specific to obesity, it's like, it ranges widely, but I think the last thing I saw was like 15% or something. So what we do know is that a lot of studies have been showing that certain things may put people more at risk. So a lot of studies, again, in our most recent review paper, we go through a couple of them, but a lot of studies have shown that people of higher weight status are more likely to show differential brain responses to highly palatable foods. I don't know why, but I think that's really important to try to figure out. And again, also eating behaviors, like people with binge eating behaviors are also more likely to, again, show those differential brain responses, even aside from how much they weigh. And so there are certain things that we're seeing that increase the risk of showing these addictive responses, both in the brain and also behaviorally. But when it comes to genetics, I've seen some studies suggesting potentially a genetic component. But again, this topic is so new. Some studies have also failed to show that. So we're not really sure. As well as, with the environment too, like you said, the highly palatable food availability in our environment is also a huge factor, that it's hard to be addicted to something if it doesn't exist, and it exists very widely in our society. So I think that is definitely a factor. So I think, like most things, this is probably a matter of both nature and nurture in a lot of different ways. Some that we're, aware of, or at least theorizing right now, and some that we're not. I do want to say that there are some studies suggesting, and I've seen a couple of researchers publish papers that have talked about this, but some studies have suggested that not necessarily just the availability of the highly palatable foods, but also the way in which we have access to it can influence these addictive-like symptoms. So in a recent paper, the authors were Fletcher and Kenny. They or one of the authors discusses this in that paper, that a lot of the animal studies that we've done on food addiction have been in very, controlled environments where they're given intermittent access to highly palatable foods. So they go periods of time without, being given those high sugar foods. And then they have a period of time where they are given those foods, and then it's taken away, and then they can have it again, then it's taken away. And so some of these other researchers, including in the Fletcher and Kenny article, have proposed that, maybe there is less evidence for these addictive-like symptoms in rats, because it's mostly been in rats so far, but in rats who have full access to the foods, but it's been more in rats who have the restricted or intermittent access. And so this has yet to be replicated in humans. But one theory that people have put out there is like, what if it's more the uncertainty of availability of these foods that can produce these addictive-like symptoms than than just the foods themselves. And so if that is, I think that'd be really important to look at, because in humans, although we have, more freedom than rats, we can, go to McDonald's. If you have a car and if you have money, you can go to McDonald's or wherever you want to get whatever food you want almost anytime. However, we do have a very, and I know in bodybuilding, you're aware of this professionally too, but we do have a very on-off kind of mentality when it comes to food consumption, especially these types of high sugar, high calorie foods. And so some people have proposed perhaps that mental restriction or that intermittent access that happens through dieting, maybe that could be influencing some of these addictive-like symptoms, and kind of reducing that restriction maybe could help with some of these out of control feelings around these foods, and that's kind of also overlapping with the kind of intuitive eating mindset as well, which I know you've done a podcast on too. So, but most of that is theory right now when it comes to humans, but I thought that was an interesting commentary on our environment too.
Yeah, I love that. You mentioned bodybuilding there. I think for our listeners, regardless about how you feel about this concept of food addiction and whether or not it exists, can diet for a bodybuilding show and then come out of that and then tell me what your focus is on food. Even if we like I think it's difficult to say that, there are no circumstances ever where food addiction is a thing. Just diet for a bodybuilding show and then tell me about how interested you are in food after, and then whether or not food addiction exists. But you mentioned a couple of really interesting points there that I think segues nicely into one of the topics I want to touch on, and that is kind of strategically how do we deal with food addiction? How do we control this wanting for food, thinking about food all the time? And when we look at the nutrition literature, as you alluded to there, and we consider these ideas of rigid dietary restraint and flexible dietary restraint, it seems to be pretty clear that these rigid approaches tend to result in some negative consequences when it comes to food. Basically, if you don't allow yourself to have certain foods, there's going to be a breaking point where maybe you're put in front of this food and then you just find you can't control yourself. And for that reason, it seems that these flexible attitudes towards foods and including certain foods in moderation tends to be a better approach long term. But you also talked about some rodent research there which would support this as well, right? When they aren't allowed access for a certain period of time, then they show more addictive qualities when they're put in front of it. And we have these correlating bodies of evidence, but then also, as we discussed, if these things didn't exist, we wouldn't be talking about this concept of food addiction, right? Our hunter-gatherer ancestors did not have to face the problem that is food addiction. So in that respect, so in that respect, it might seem like to some people, well, it would just be best if I didn't keep any of these foods around at any point, and I just tried to erase them from my life, whether that's realistic or not. They might think that sounds like a good idea. So with all of these things being said, as a psychologist, considering your background in bariatric, what do you think is probably the best approach for most people when it comes to this concept of how they should view food, how they should be implementing certain foods that might be triggering addictive-like behaviors?
Yeah, that's a really good question. I think that is the question of the day for anyone studying food addiction, for sure. And it's really hard for me to say. I guess one, because I've flip-flopped so many times. I'm like, oh, I think this approach looks promising for treatment. I think this approach looks promising for treatment. And I think probably everyone has, changed their minds at least a couple times. At least I have. But I think it's especially hard to say because everyone is so individual. Even when it comes to substance use disorder treatment, different things work for different people. Some people work best with things like Alcoholics Anonymous, getting that social support for total sobriety. Some people work best with just getting the support they need to be moderate in their alcohol consumption, if we're talking about alcoholism. Some people do best with just not even seeking help, just stopping cold turkey themselves and totally doing a 180. And so I think when it comes to these addictive like symptoms towards food, I think it's probably going to be pretty similar. Everyone is a unique individual who has different approaches that will work best for them. However, in research, we work with averages of large groups of people. So we're still trying to find like, well, what is most effective for most people? And right now there's like hardly any research. I'll give you an overview of what people have looked at so far. But in short, there's not evidence for any really evidence-based treatment yet. Let's see here. So some people, most of us agree that we should look at substance use disorder treatments for ideas of kind of where to start with treatment of food addiction. And then also, obesity treatments and eating disorder treatments have also been, kind of up there on the list. Some of the main thoughts that people have been proposing of like types of treatments could be, some people have proposed like total abstinence. That's a pretty common one, especially in a lot of kind of like private marketed, food addiction companies seeking to help people with food addiction. Others have proposed maybe harm reduction approaches. So like kind of like in substance use disorder treatments, if you're taking a harm reduction approach, the goal is not really to stop completely. The goal is to like, how can we reduce the negative consequences of this behavior as much as possible? At least that's how I understand it. And then others have, suggested moderation approaches. And then others have suggested even no really kind of restrictive approach at all. So like I've seen one study test out an intuitive eating intervention in a pilot study, which just means it was a really small kind of preliminary study. They actually found no effect of intuitive eating on food addiction symptoms. Again, that was one study, but they did find an effect of a stress management intervention on food addiction symptoms, but it didn't last long term. But again, we don't really have any studies showing hardly any results, especially not long-term results for food addiction treatments. There are some studies showing positive results in behavioral weight loss programs. So that's where you usually that involves cutting calories, increasing exercise to lose weight. People, including myself, have looked at food addiction symptom trends during those programs, and they do tend to go down. But again, we don't really have evidence of like how long does that last? Is that just a temporary thing? So that's something that we really need to keep looking into.
Fantastic. I really like that you said that it is an individual approach and there are a variety of paths that you can take depending on the individual. This is something that I find interesting when we compare the research to In the Trenches dealing with individuals, and that generally speaking, you're taught in dietetics that rigid restraint is just taboo. Like it's not something you should suggest ever, and every food can be consumed in moderation. But I see all the time within, people on Twitter who talk about their success on a ketogenic diet, or some people just find it almost impossible to moderate the consumption of certain foods that, I don't know, perhaps for some individuals, just completely removing themselves from these certain types of foods might be a viable and even the most effective option. And while it's the research certainly would not point in that direction on average, I think it might be useful in certain circumstances. What are your thoughts there?
Yeah, I think I've definitely heard of people who found that approach to be the best one for them. and some organizations, that were started by people who felt addicted to food, and then they found that the abstinence approach is best for them. I think the tricky thing about that is like, well, what is abstinence when it comes to food addiction? Since we, if you, for example, I've, there's been some cases where someone will cut out one food that they're like, okay, this is what I'm addicted to. I'm going to cut out all sugar. And then they find that once they cut out sugar, they start feeling addicted to other types of sugars like lactose, and dairy products. And so they're like, okay, I have to cut out all dairy products. And then next they have to cut out all grains. And, so it can get to be a slippery slope for some people. And so I think that, I guess, being very mindful about how one is doing that and making sure that they're using other people as a soundboard and getting adequate nutrition is probably important, because I've also heard of cases, and again, this is just more anecdotal, but I've heard of cases where people are like, it's possible for someone to feel like they're addicted to food, but it might be more of like they're craving something for a reason, right? So for example, like if someone is on a strict diet and they're limiting, either certain food groups, or they're limiting the number of calories during the day, and then they find they just can't stop eating at night, they feel out of control. That sounds like more of like their body needs food, they're not giving it the food it needs, and so it's like asking them very strongly in the evenings and almost overriding their self-control to get that food. But then how that person might see it is like, oh, I have no self-control, I'm addicted, I can't stop myself. Whereas like in that case, maybe they're just not getting the nutrition that they need. And so I think that that's another important area to look at, and also to be mindful for any kind of clinician working with people who feel addicted to food, is like, are they having a balanced diet? Are they having the nutrition that they need? And especially as a dietitian, you would know a lot more about that. But because our bodies have a way of, asking us, for what they need. Yeah, so I think that's an important factor. I think I kind of went on a tangent there, but so long story short, I think sometimes abstinence, a lot of people say that abstinence does work for them, but I think that being careful with that too, to make sure it's a balanced abstinence, as opposed to restricting more and more until you only have like, this amount of food that you're allowing yourself.
Yeah, I totally love that nuance. That makes something else come to mind for me, and is that it is this addiction to food, or perhaps we have these other underlying issues, and we're turning to food as an outlet. You mentioned recently about, stress management potentially being more effective for certain populations than an intuitive eating approach. And then, that makes me also think about it if we look at something like IBS, or and how there is this pretty strong correlation between IBS symptoms and depression, and how we see this effectiveness when we introduce therapy. It potentially has nothing to do with, hey, you need to go on a low FODMAP diet and remove these foods, and you have all of these trigger foods, and it's like, really, there's just these other symptoms, and we know that there's a strong connection between the gut and the brain, and when we sort these negative feelings and emotions out, that can alleviate, and we didn't need to do anything diet related whatsoever. So that just makes me think about, potentially food addiction, and whether it is like this physiological connection to food, or if we're just using it to treat something else, and then we should be seeking a whole other intervention besides looking at the specific foods in general.
Yeah, I love that point. Like as a psychologist, I'm always loving looking at the side of like, what are the psychological components that could be contributing to this? Yeah, that's a really good point. So yeah, I think absolutely. And again, there hasn't been much research or any research that I've seen that I can think of right now that has looked at like, if there are psychological causes to these addictive like symptoms, not necessarily the food itself. However, in the eating disorder literature, everyone knows who works with eating disorders that eating disorders are not about the food. That's just, kind of a surrogate for what's really going on. And I think, personally, I think it's probably something similar with a lot of people who feel like they're addicted to food. For example, I had one patient who had binge eating disorder. She wasn't, again, food addiction is not a diagnosis, but she was being treated for binge eating disorder because she was having actual binges. And we talked about in one of our therapy sessions, we talked about like what types of foods she's craving and when, because different people tend to binge on different things individually. And so for her, it was mostly like carbohydrates. She'd binge on bagels, bread, things like that. And so we talk about, well, like what are the like chemical purposes of carbohydrates, for example? And it's like, well, two of the main ones that I know of are energy, just giving you energy, and then also they tend to increase serotonin, so they give us kind of a feeling of feel good, comfort, especially if it's refined, then that gets to be quicker. And so we talked about, are you missing either of those components in your life right now? Are you missing those feel good feelings? Are you missing energy? And she was tired like all the time. And so it's like, okay, well, where can those things come from? And so she was able to have good insight into kind of her lifestyle and realize like, I'm not really having a consistent bedtime. I'm not really getting adequate sleep. And so we started working on that. Like, okay, let's see what happens to your appetite when you start getting better sleep. And then also when it came to the feel good feelings, that kind of more pleasurable or comforting response, she identified like, well, there are some things that I'd like to do that I'm not doing that make me feel good. And so it's like, okay, well, what are some of those things? One of them she mentioned was just like social contact. She was so busy, she wasn't talking to her friends anymore. So she made a goal to like literally call, not just text, but call and like have a conversation with one of her close friends. I think it was every week or something like that. And so when she started doing that, and again, this is a lot quicker than I see with most patients. But for her, when she started doing those things more consistently, and she also picked up a walking routine, she found it took like only a couple weeks. She was no longer binging anymore. She was no longer even craving carbohydrates like she was before. And she used to think about food all the time. It used to always be on her mind. She felt like she had to fight herself all the time. She said she was hardly ever even thinking about it unless it was like a meal time. And so I was like so happy for her. But I think that's one example of like a lot of times we have real needs in our lives. Sometimes we look at pleasure as like a bad thing. Drugs cause pleasure, whatever. But everyone needs pleasure. That's like I believe that's a human need. And everyone needs energy and sleep and stuff. And so I think when we're not getting the things that we need, it's easy to turn to like a quick fix for it. And for a lot of us, food can be a quick fix, especially if we have certain mindsets or live in certain cultures that see food certain ways. But yeah, I think that's very possible, and I've seen that with a few patients. So
I really appreciate that example. Thank you for sharing that.
yeah.
Now, you mentioned there binge eating disorder, and this was something that I thought was particularly fascinating about your review paper, and that was kind of parsing out these similar things, which is binge eating disorder, food addiction, obesity. Some people might automatically hear these things and just think they all kind of ultimately go together. If you are having binges, then you must be addicted to food at some severe level. And then if you're addicted to food, then by default, you're probably going to be obese. But it's a little more nuanced than that. Is that correct?
Yeah, absolutely. In the earlier days of food addiction research, obesity and food addiction were kind of talked about synonymously, which now we look back on that and we're like, oh. um, at least that's how I feel. Yeah, so like I said before, only like the latest study that I saw suggested that only like 19% of adults with obesity in the US meet the like criteria for food addiction on our questionnaire. And that's totally, I guess I'll just start with obesity since I started there, and then I'll go to binge eating disorder. There are so many things that can cause obesity. Many of them, thankfully we're starting to move away from the low self-discipline explanation for obesity, because clearly there are many things that are not even eating related that can cause obesity. We know medications cause, weight gain as a side effect. We know genetics can play a component. Mental health, definitely. And anyways, there's a lot of different factors. And so, yeah, so food addiction is definitely not like the explanation for obesity. Do some people with obesity feel addicted to food? Yes. Do more people with obesity feel addicted to food than people without obesity? Yes. Does weight seem to have an impact on the addictive-like responses we're seeing in the brain and behaviorally in the studies that we're doing? Yes, it does. But we don't know what comes first necessarily, or what can influence the other first. And the literature on weight loss and food addiction symptoms, looking at does weight loss correlate with improvements in food addiction symptoms? Because there's been a few studies looking at that. The literature is, some say yes, some say no. Like, some have found a correlation, some haven't. So it's a very nuanced relationship between weight and food addiction symptoms. But long story short, obesity and food addiction are definitely not the same thing. Some people who are normal weight report feeling addicted to food too. I think the last statistic I saw was like 11% or something like that, which isn't that much lower than 19%. So food addiction is more of a what is your relationship with food, as opposed to how much body weight are you carrying. Regarding binge eating disorder, that has, I think, about a 50% overlap, the last statistic I saw, with food addiction symptoms. So a higher overlap, but still, it's that's still only half. And I kind of think of so both binge eating and food addiction symptoms involve a sense of loss of control, a sense of, seeking a sensation, you could say, whether consciously or unconsciously, and that reward response in the brain. However, and people with binge eating behaviors tend to show more addictive-like responses in the brain and behaviorally too, in studies that we found. But kind of like how binge drinking is not the same as alcoholism. That's kind of how I equate binge eating with food addiction. It's yes, there's overlap, but not everyone who binge drinks is an alcoholic, and not everyone who binge eats is addicted to food, and not everyone who's an alcoholic binge drinks, and not everyone who is addicted to food binge eats. Some people's food addiction might show up as more like grazing throughout the day. I had a patient the other day actually who was just telling me that that's how she feels. So yeah, so there's overlap, but they're not really the same.
Great context, something we're particularly fond of on the Muscle Memoirs podcast. We don't shy away from the weeds here, so I know the listeners are going to appreciate your response to that question. As we're wrapping up our discussion here, and if we're on board with this concept of food addiction, and we're curious about it, and perhaps how it applies to maybe us, the question then becomes, well, how do we measure food addiction? Is there an objective way to assess whether somebody might be addicted to food or not?
Yeah, that's a great question. Um, Short answer is that the best and most commonly used way that I've seen is the Yale Food Addiction Scale. It basically takes the diagnostic criteria from the DSM-5, the Diagnostic Statistical Manual of Mental Disorders, and just kind of replaces the name of the substance with food. So that's pretty simple. It's the same way we assess for substance use disorders. We look at that criteria, see if people meet it. That questionnaire makes questions from those criteria to see if people meet those criteria when it comes to food. Theoretically, that's kind of the one that makes more sense for me. Some people have developed other questionnaires that probably look promising, but I haven't seen them used as much in the literature. It's also kind of tricky because food addiction is being more accepted, and there is more and more evidence showing addictive-like responses. But again, it is so nuanced and it is so controversial, and there's so much we don't know that it's like many are not even convinced that this is something that we can measure, because, like, you know, is it something that exists, or is it more a reflection of other stuff going on? And I think the evidence is leaning more towards it is, you know, a real thing, but there's also so much we don't know, so that could change tomorrow, you know. So it's yeah, but the best measure we have right now is, I think personally, based on the DSM criteria for substance use disorder.
Great. All right, Dr. Gordon, last question for you here. Food addiction, it's an emerging field. It's rapidly evolving. It sounds like we still have a ton of questions that need to be answered. So, what are your thoughts on the most interesting aspects of this area? What is the primary question in your mind that still needs to be answered at this point in the research?
Yeah. Oh gosh, so many things. I think one of the biggest questions that I have, and that a lot of people have in this field too, is like kind of teasing out what is the relationship necessarily between weight and these addictive like symptoms. Because like we said, there is a clear relationship, but does one cause the other, or are they both symptoms of something else entirely? I don't know. So I think that's an important question, because I think the obesity crisis is what's really, I think, fueling this interest in food addiction. Because a lot of people are feeling, you know, if you're struggling with weight, a lot of people struggling with weight feel like, oh, it must be because I'm out of control with food. And, you know, on the outside, a lot of professionals feel like, why can't they just stop eating, you know, to lose weight? So I think kind of teasing out, trying to understand that relationship is super important. And again, like we were saying before, like there's a lot of efforts now moving towards like, how do we help people who are struggling with feeling out of control with food? And again, I think that's also another really important question.
Yeah, ultimately, I think this is a super promising area when it comes to helping to attenuate this obesity crisis. I mean, recent statistical models on the issue don't look too friendly to what's going to be happening in the next 10 years or so. It doesn't seem like things are improving. I think this is definitely a good way to help rectify some of that. But that does it for another episode of the Muscle Memoirs podcast. Dr. Gordon, for our listeners who want to learn more about you, go support you, where can you point them toward?
Well, I don't have like a website or anything, but you can look at our papers. We can put links to them on this podcast, some of the research papers that I've done with colleagues. Yeah, and I also want to add, my views do not represent my universities that I am working for. So
No social media, Twitter, Instagram, anything like that?
no, not really. I have a LinkedIn page, but yeah, that's boring.
Alrighty. We will definitely link the research papers of discussion today in the show notes. Thank you so much for listening, everyone. Thank you for your time, Dr. Gordon.
Thank you.